So, a lot of the physicians that we work with, not just at Penn State, but we have several that, work through UPMC and WellSpan, and it's just become more of a referral, relationship. We have some spine specialist back surgeons who really want to give their patients other options before they do have to enter into more invasive procedures like injection surgeries, so on and so forth. So I think being the kind of office that is evidence based, is open to conversation, is open to referring patients that we feel may be candidates for surgery, and really showing these professionals that despite what they may have heard or been taught, throughout their education, that there are absolutely chiropractors and PTs and acupuncturists and people out there who are excited to be able to collaborate as long as again, it gives the best outcome for the patient. So, we try really, really hard to, follow our schooling and make sure that we're doing really, really good, thorough exams with our patients. We do digital x-ray right in the office to make sure that we are treating appropriately, we're keeping our patients safe, and we're very comfortable making referrals outside of the office if there is something that we feel is outside of our scope. And finally, we do reach out to other providers. If we have a case that we're just not sure, it's something we haven't seen before, I love reaching out to other providers and asking, have you seen this? What's your take on it? Would love to collaborate and work with you. And it's, for the most part, really, really gotten us some just really beautiful collaborative relationships with other healthcare providers. There's always going to be a population of doctors that just simply don't know what it is that a chiropractor does, what our training is, and, kind of has this belief that, we're trying to overstep or that we're trying to get in the way, or that we don't know what we're doing. So I don't think that's going to go away entirely, but I think that if you can set, your ego aside, I think if you can set the stigmas aside and get to know other providers and what we can do to work together, I think it just makes huge strides in healthcare. And like I keep saying, it benefits the patient, and that's always the right
That's the
answer.
goal, right? Yeah.